My name is Stefan Diederich. I'm going to be the ICIS President in 2017, which we will organize in Berlin, in Germany, on October the 2nd to October the 4th. The meeting will be held in the city center of Berlin, in Langenbeck-Virchow House, which is walking distance to many of the main attractions of the city, such as the Museum Island, the Brandenburg Gate, the Reichstags building, and many other attractions. Well, we have a focus on the multidisciplinary approach to cancer treatment, in that we not only organize the conference together with the German Röntgen Society, which will advertise the meeting to its many members, but we also invited the German Society of Radiation Oncology to join in, and they agreed to send speakers and also send delegates. We have invited the medical oncologists in Germany, the European Society of Therapeutic Radiation Oncology. So it will be a truly multidisciplinary meeting with input from not only imaging, as we usually do, but also therapy in cancer patients. The formats will change slightly. We continue to do the formats we have been using for many years, so there will be formal lectures, we will have pro and con sessions, we will repeat the interactive sessions with audience response systems, and we will do a series of hands-on workshops again, which means that up to 50 delegates will sit on real workstations and view complete DICOM data sets of cases and discuss the findings and come to diagnosis together with two lecturers who support that course. A new feature which we are going to have next year is live cases, due to the fact that we are going to hold our meeting very close to the big university hospital, Charité Hospital in Berlin, and we will have groups of delegates watch live cases in Charité Hospital as well as in Berlin Lung Hospital, and they will be able to see treatment of cancer patients with tumor ablation, such as radiofrequency ablation or microwave ablation, and they'll be able to watch transarterial therapy, such as transarterial chemoembolization or radioembolization. This will be done in small groups and with tutors supervising probably 5 to 10 delegates on pre-registration. Well, it's very important in the field of oncologic imaging and oncologic therapy because a lot is going on at the moment. Imaging has changed dramatically in the assessment of cancer patients over the past years. This does not only involve the detection of cancer and a proper diagnosis, but in particular it involves the assessment of therapy response. There are new drugs available which cause completely different reactions in the patient, and if we as radiologists don't learn about this, our reports will be wrong basically. So it's crucial that we are trained constantly on the new developments in order to provide the best service to the patient. Well, next year we hope to attract about 500 delegates. The focus of the meeting is obviously oncologic imaging, which means that many of the delegates have an interest in oncologic imaging, and the number of people who can focus on oncologic imaging is somewhat limited. So 500 delegates at a specialized meeting like this is actually quite a high number, and this is about what we reach every year, sometimes less, sometimes a little more. Well, I think Berlin is certainly one of the most vibrant cities in Germany, if not in Europe at the moment. There's so much going on since the fall of the wall 25 years ago, and we have a very rich cultural scene in Berlin. There is a lot of interesting sightseeing. We've got the best museums of Germany in Berlin, and many of the sites are very close to the conference venue. So I strongly recommend not just come over for the conference, but have a little time before or after the conference to see the many attractions of Berlin.